Hello everyone. So we will begin with the MCQs, and the first one is the mean of a data set is 2 and median is 3. So what is the mode? The options are 5, 2.5, 4 and 3. So it's a question. It's a PSM question, and the question here is the mean of a data set is 2 and median is 3. So what is the mode? So it's a PSM question and you have to know what it is, and the options are 5, 2.5, 4 and 3. I repeat, the question is the mean of a data set is 2 and the median is 3. So what is the mode? So we all know it's a mean, median and mode. So in this case it's asymmetric distribution is there. So we have to know the formula here for the mode. So the options are 5, 2.5, 4 and 3. So as we know, it's the formula for median for an asymmetrical distribution is like it's a 3 median minus 2 mean. So it's like a 3 into 3 minus 2 into 2. Here it comes to 5. So the answer here is 5. So you got to know the formula and that's it. Nothing else. So next we move on. It's a question we have. It's a 55-year-old man who has the following findings on routine CBC. So the CBC findings are hemoglobin is 8.4, WBC is 1,65,000 and platelet is also 6,10,000. So basically it's a case of 55-year-old and peripheral smear is also performed here. So now you do a bone marrow aspiration. In case of a bone marrow aspiration, so which of the following is likely to be seen on the bone marrow except, and the options are hypercellular bone marrow, myeloid erythroid ratio is that is a 15:1, or it's a marrow blast that is greater than 20%, or it's a case of C blue histiocytes. So basically they have given a case of a bone marrow aspiration, and thus in the bone marrow aspiration the image which has been shown here, it shows the precursor cells, that is metamyelocytes, blast cells can be seen, myelocytes can be seen, neutrophils can be seen. So in just the case of, if you can, I will just repeat once again. It's a 55-year-old case and male patient, and the CBC is hemoglobin is 8.4, WBC 1,65,000, platelet is 6,10,000, and you perform a bone marrow aspiration for this condition. So which of the following will be likely seen in the bone marrow except? The options are hypercellular bone marrow, it's a myeloid erythroid ratio that is 15:1, or it's a marrow blast greater than 20%, and the last one is C blue histiocytes. So if you can just diagnose this condition, then only you can answer. So anyone wants to diagnose first? So okay, it's basically if you see the precursor cells in the bone marrow biopsy, that is it's a left side chain you are going. So it's basically you have to think of CML in this condition, because it's a left shift with a predominance of segmented neutrophils, myelocytes, metamyelocytes, which is suggestive here of CML. So in CML, what you see in blood and what you see in bone marrow is totally different. In bone marrow, it's like marrow, that is the blast cells, will be less than 5%. So the right option here is marrow blast that is greater than 20%, which is the exception case here. So you can see hypercellular bone marrow, myeloid erythroid will basically it will be increased because myeloid precursors are more in this condition, and you will see a C blue histiocytes. So moving on to the next, which of the following statement is false regarding the lymphoma of the small intestine? And the options are A, that is the B cell lymphocytes are chemo-resistant, and it is the most common tumor of small intestine in children, or its resection is indicated in all symptomatic patient, and Burkitt lymphoma appears the ileocecal junction. So I repeat, it's basically which of the following is false regarding the lymphoma of the small intestine, and the options I will repeat, it's a B cell lymphomas which are chemo-resistant, or it is the most common tumor of the small intestine in children, or it's like a resection indicated in all symptomatic patients, and Burkitt lymphoma affects the ileocecal junction. So if you want to answer this. So no one, okay. See, the answer there is it's like a B cell lymphoma or chemo-resistant, which is the false. Because see, it's a B cell lymphoma are very much chemosensitive in this condition, and so B cell lymphoma are very much chemosensitive in this condition, and it's like a most common tumor of small intestine in children, that is the lymphoma small intestine which we are talking here, and resection is indicated in all symptomatic patients because basically it's a risk of carcinoma is there, and it's a Burkitt lymphoma affects the ileocecal junction. That is also the right option here. So yeah. So yeah, we'll move on to the next question. It's a 22-year-old man with sustained a roller crush injury of his left arm up to the mid-humerus and was brought to a casualty. So the duty of orthopedician uses the mesh score to decide about the limb salvage. So the score does not include which of the following. Basically, it's a classification. It's a parameter that means which that is a mesh score. So you have to just tell the score does not include which of the following. And the options are age of the patient, ischemia, neurogenic injury, or is the energy of injury. So yeah, if you can tell this answer. It's a 22-year-old man who sustained a roller crush injury of his left arm up to the mid-humerus and brought to the casualty, and you are the orthopedician there, and you are basically using the mesh score to decide about the limb salvage. So what is the score does not include what? It's age of the patient, ischemia, neurogenic injury, or is the energy of the injury. So yeah, if you can tell the answer here. Okay, the answer here is it's like C. That is, we don't use a neurogenic injury in case of the mesh. And what is the full form of mesh? Mesh is like it's a mangled extremity severity score. So yeah, the parameters we use in the mangled extremity severity score is shock, age of the patient, the limb ischemia, and the energy which is the you are causing the trauma, that is the injury, skeletal and soft tissue injury. So I repeat, it's a mesh, that is a mangled extremity severity score we use as an orthopedician. And what is that? It's a limb ischemia, shock, age of the patient, and the energy that has caused the joint. Okay, yeah. It's a neurogenic injury is not included in the mesh, what I was telling. So I will move on to the next question. The question here is, it's a 60-year-old man who comes to the OPD with the complaints of bluish discoloration of the skin on a sun exposed areas. So he has been on medication for monomorphic ventricular tachycardia for the past 3 years. So which drug is most likely to be implicated in this condition? And the options are lidocaine, adenosine, amiodarone, or it's a merzilatin. I repeat, it's a case of a 60-year-old man who comes to the OPD with bluish discoloration of the skin on the sun exposed areas, and he has been on medication for the monomorphic ventricular tachycardia for the past 3 years. So which drug is the most likely implicated in this condition? It's lidocaine, adenosine, amiodarone, or it's a merzilatin. So if you want to answer this, it's basically what I think is Okay, if you want to answer. So it's a blue man syndrome. So in case of a blue man syndrome, basically it's the drug which has been implicated is amiodarone. So it's basically one of the side effects of amiodarone is So one of the side effects of amiodarone, we know it's photosensitivity, and that only they have given, that is there is a bluish discoloration of the skin on the sun exposed areas. So it's basically, it could be due to the immune response in dermal layers by the amiodarone, or accumulation of the amiodarone in the superficial layers. So it's due to the photosensitivity. No, adenosine is not there. Adenosine, it's not there. So others also we have like red man syndrome. In case of the red man syndrome, it's vancomycin, that is the drug associated, and it's a grey baby syndrome, we have chloramphenicol. So you have to remember like this. If it's a blue man syndrome, it's amiodarone. If it's a red man, it's vancomycin. Or it's like it's a grey baby syndrome, and it's a chloramphenicol which has the adverse effects. So let's move on. Which of these parameters would be considered a poor prognostic factor in patients with Hodgkin's lymphoma? And the options are serum albumin less than 5 gram per dl, or it's a WBC count less than 15,000 cells per cubic mm, or it's a absolute lymphocyte count less than 600 cells per cubic mm, or it's like a age which is less than 45 years. So I repeat, which is a poor prognostic factor in Hodgkin's lymphoma. And the options I said, it's a serum albumin level less than 5 gram per dl, WBC less than 15,000 cells, that is a ALC, that is absolute lymphocyte count less than 600 cells per cubic mm, or it's a age which is less than 45 years. So if you want to just tell, I think it's okay, anyone wants to answer? So the answer here is C, that is the absolute lymphocyte count is less than 600 is a poor prognostic factor. See, the first option was albumin level. So albumin level is less than 4 gram per dm, then only you can tell it's a poor. And then we had WBC count. WBC count also it should be more, not less than 15,000. And age also should be more than 45 years, then only you can tell it's a poor prognostic factor. So the answer is, that is ALC is less than 600 cells per cubic mm, that is the poor prognostic factor here. And it should be a male gender, hemoglobin less than 10.5, and that's all. So next we go on to that is a patient with a parathyroid deficiency 10 days after inadvertent damage to the parathyroid gland during thyroid surgery would probably have. So it's so many options. So I'll just repeat, it's a patient with a parathyroid deficiency 10 days after inadvertent damage to the parathyroid glands during thyroid surgery would probably be. Its options are high plasma phosphate, low calcium levels, and tetanus. It's a low plasma calcium levels, increased muscular excitability, and Rossio sign, that is positive. And otherwise it can be a high plasma phosphate and calcium level and bone demineralization. On the last option we can have is increased muscular excitability, high plasma calcium level, and it's a bone demineralization. So it's the options are very long here. So but if you have a parathyroid deficiency, just think of it, what will the effects here. So anyone wants to tell? Parathyroid hormone deficiency will cause what? Okay, the answer here is, it's like a B, that is, basically in the parathyroid hormone, if it's a deficiency, then calcium will be, it will be low calcium, that is the serum calcium will be less, and that will lead to tetany, and Rossio sign will be positive in case of hypocalcemia. So and phosphate levels will be high, because more and more it will be the retention of the phosphate will be there in this case. So so we know parathyroid hormone, that there will be more bone resorption in case of a parathyroid hormone that is deficient. So if you have a parathyroid hormone deficiency, it will lead to hypocalcemia and tetany, and then Rossio sign is a part of that only. So we will move on. It's a mother who asked for LASIK surgery for the correction of a 15-year-old daughter. That is myopia, Sana's myopia. So which of the following is not an eligibility criteria for this procedure? So you have to tell which of the following is not an eligibility criteria for LASIK surgery for Sana's myopia. Options are stable refractory refraction for the last 1 year. It's a corneal thickness of 600 microns. It's the age of 15 years, or it's a myopia of 4D. See, what I know, if you have myopia of 4D, we can do. So I'll just repeat the options here. The options are, it's a stable refraction for the past 1 year, or corneal thickness of 600 microns, age of 15 years, or it's a myopia of 4D. So in which condition it's not an eligibility criteria for LASIK? Anyone wants to tell? What is the answer here? So okay, I will just tell the options once. I will just tell what it is. See, the right answer is age of 15 years. See, if you are doing a LASIK surgery, you have to remember it should be greater than 18 years and not 15 years. So you should be an adult for a LASIK surgery. So that is a minimum criteria, and there should be a stable refraction for the past 1 year. That is also criteria. And then we have a corneal thickness of 600 microns, and at last there should be, see, myopia of 4D, then only they will do. Otherwise they don't do. Below myopia of 4D, no one will do a LASIK for you. So and if there is an unsatisfactory result using the non-surgical treatments, so that is all the criteria for LASIK. So moving on, which of the following is not an early feature of the condition depicted below? So they have given an image below. So I will just tell you what is the image. Okay, the image is basically, it's a leprosy. It's a case of a leprometal leprosy in this case. So what you have to tell, which of the following is not an early feature of the condition, that is the leprometal leprosy. So the options are, it's indistinct shiny macules with normal sensation, or we have a nasal stuffiness, crusting and epistaxis, or edema of the ankles and legs, and the last one is stalking and love anesthesia. So basically you have to tell which of the following is not a part of the leprometal leprosy. So if anyone wants to answer this, that is indistinct shiny macules with normal sensation, nasal stuffiness, crusting and epistaxis, or it's a edema of the ankles and legs, And last one is the stockings and the love anesthesia. So yeah, which is the early feature basically. All of the features of Leprometal leprosy, but which is an early feature in this case. So yeah, if you want to answer this, okay, I will only answer. See, in this case, in case of a Leprometal leprosy, stocking and love anesthesia is not an early feature. It's a late feature. And others, what I told, that is a nasal stuffiness, thrusting, epistaxis and all, it's a early feature. Edema of the ankles and leg also, it's early feature, and indistinct shiny macules with normal sensation. So yeah, the late feature is stocking and love anesthesia. So you have to remember in that way. So yeah, next we move on. Next question we have, it's CGG pre-mutation in FMR1 gene are characteristic of which of the following? I think you might be knowing or may not be, but I will repeat. It's a CGG pre-mutation in the FMR1 gene is characteristic of which of the following? And the options are Fragile X syndrome, it's a Prader-Willi syndrome, it's a Fragile X ataxia, or it's a Friedreich's ataxia. Anyone? See, I think no one will know, but yeah, if you know the answer, it's better only. I'll just repeat. It's a CGG pre-mutation in FMR1 gene, characteristic of which of the following? Fragile X syndrome, Prader-Willi syndrome, Fragile X ataxia, or it's a Friedreich's ataxia. Anyone? Okay, I will just tell. I also don't know the answer here, but yeah, from here what I know, it's a Fragile X ataxia is the right answer, in which there will be a CGG pre-mutation in the FMR1 gene. So yeah, so you know what is Fragile X ataxia? Basically, it's also known as the Fragile X tremor, and it's associated with primary ovarian failure. So yeah, and Fragile X associated with primary ovarian failure. So next we have, it's a 45-year-old woman who is suffering from Hutchinson chorea, and she is on haloperidol. So which of the following adverse drug effects is best attributed to the supersensitivity of dopamine receptors? I will repeat. It's a 45-year-old patient comes to you who is suffering from Huntington's chorea, and he is on haloperidol. She is on haloperidol, and which of the following adverse effects is best attributed to the supersensitivity of the dopamine receptors? We are talking about haloperidol, and the options are, it's a muscle rigidity, labile blood pressure, hyperreflexia, hyperthermia, tachycardia, and tremors. It's a very many options are there. So I'll just tell the answer here. I think telling the options only will cause so much. So yeah, the question was basically, it's a Huntington's chorea and that too on haloperidol. So which is following the drug effects is best attributed to the supersensitivity? So yeah, the options are lips. The answer is basically, it's a lip smacking, facial dyskinesia, protrusion, and rolling of the tongue, involuntary movements of the extremities. So yeah, basically in case of haloperidol, you know, it's a tardive dyskinesia, and all the features which I said, it's on the side of tardive dyskinesia, and it is caused by supersensitivity of the dopamine receptors. So yeah, the answer was lip smacking, facial dyskinesia, protrusion and rolling of the tongue, involuntary movements of the extremities, and all these are tardive dyskinesias, which is seen in case of adverse effects in haloperidol, you can say. So yeah, it's due to supersensitivity of dopamine receptors. Next we move on. It's a 35-year-old man who died due to suicidal poisoning. So you do a forensic expert comes and he examines the case during postmortem and gets a peculiar garlicky smell from the nose and mouth of the body. Which of the following agent would you suspect? It's an easy question, I think, if you can tell. So yeah, it's options are thallium sulfate, hydrogen sulfide, cyanide, or it's a phosphorus. I repeat, it's a 35-year-old due to suicidal poisoning, and it's a 35-year-old due to suicidal poisoning and forensic examination you do, and during the postmortem basically you find a peculiar garlicky smell from the nose and the mouth of the body. So what is the agent which has been used here? So options are thallium sulfate, hydrogen sulfide, cyanide, or phosphorus. So yeah, if you can tell. I think, okay, just tell me the answer. If you can just tell ABCD if you want. Okay, the answer is D, that is phosphorus. So in case of phosphorus poisoning only, we will see a garlicky like odor, which is usually from the mouth and the nose. So yeah, this is also a factual question you have to remember. Garlicky odor, it's in phosphorus poisoning. So yeah, I will just tell what are the other options. Say the first was, let's say cyanide. Cyanide, if you have cyanide poisoning, you will see a smell of brittle almonds. So to remember that. Thallium sulfate was also an option. You will see odorless. It's odorless, so you will not see any odor in that case. Another option was hydrogen sulfide. So yeah, in case of hydrogen sulfide, you will see a rotten egg smell. So yeah, rotten egg in hydrogen sulfide, odorless thallium sulfate, and smell of bitter almonds in case of cyanide, and its phosphorus we have, that is the garlicky smell. So next we move on. It's PSM, I think. Yeah. Which of the following is a component of the scheme depicted below? That is the Ayushman Bharat Yojana. So if you know it's Ayushman Bharat Yojana, so which of the following is a component of the scheme? So options are National Health Protection Mission, Pradhan Mantri Surakshit Matriva Abhiyan, or it's a National Program for Family Planning, or it's a National Rural Health Mission. So it's a easy question. If from the name only you can just tell it's a Ayushman Bharat Yojana, and which of the following is a component of the scheme? I will just repeat. It's a National Health Protection Mission, Pradhan Mantri Surakshit Matriva Abhiyan, or National Program for Family Planning, or it's a National Rural Health Mission. So yeah, if you can tell, it's easy. From the name only you can know it's Ayushman Bharat will be. So okay, the answer here is A. That is the National Health Protection Mission is, that is, it's from the name only, it's Ayushman Bharat Yojana. So yeah, good. Next we move on. Which of the following nerves is related to the Doyle's canal? Cochlear nerve, oculomotor, abduction, or trigeminal. So yeah, if you know what is Doyle's canal, it's anatomical structure in Doyle's canal. So you can just tell which of the following nerves is related to this. It's a cochlear, oculomotor, abduction, or trigeminal. So yeah, if you can tell this, it's a Doyle's canal. So it's basically in the skull bone you see a Doyle's canal, and yeah, the answer is C. So basically abduction nerve is related to a Doyle's canal, and it enters the cavernous sinus by passing through this canal, and the canal is basically located in the, yeah, it's the abduction nerve. So the canal is basically located in the skull bone, and yeah, it was noted to be clinically significant in understanding the sixth nerve palsy. So yeah, that is only abduction nerve. So next we move on. The drug of choice for treatment of pregnant women. Yeah, it's a repeated question. The drug of choice for treatment of pregnant women with bacterial vaginosis is metronidazole, fluconazole, clindamycin, or erythromycin. It's an easy one. Who has been discussing from the last few days. I'll just repeat which is the drug of choice for a pregnant woman. See, remember, pregnant woman is there with bacterial vaginosis. Metronidazole, fluconazole, clindamycin, or erythromycin. So yeah, if you can tell. So yeah, the answer is A here. So we have discussed this before also. It's a case of bacterial vaginosis, and metronidazole is the drug of choice. Whether it's pregnant or non-pregnant woman, metronidazole is the drug of choice for bacterial vaginosis. So yeah, next we move on to the next question. It's a patient, it's a farmer who works in a paddy field presented with fever. Yeah, please repeat. So actually I just went up with the question. Okay, last question was, what was the drug of choice for a pregnant woman in case of bacterial vaginosis? So in case of bacterial vaginosis, the drug of choice is metronidazole in both pregnant and non-pregnant women. So that we have to remember. So there is no difference between pregnant and non-pregnant women in case of bacterial vaginosis. So yeah, next we move on. It's a case of a farmer who works in a paddy field, and he presents with you with fever, intense myalgia, and hematochezia. So lab investigation you do, it shows a sharply elevated creatinine levels and high liver enzymes. So what is the causative organism? So basically just tell me what is the diagnosis here, because without that you cannot tell what is the causative organism. So I'll just repeat once. A farmer is there who works in a paddy field. He presents to you with fever, intense myalgia, and hematochezia. So you do a lab investigation, you find there is an elevated creatinine level and high liver enzymes. So yeah, anyone who wants to tell a diagnosis, if you want to tell, just tell, otherwise I will just tell the answer here. Okay, I will just give you a hint. It's a causative organism, that is the answer here is Leptospira. So now at least you can tell Leptospira will be the causative agent for which disease. Anyone? It's a syndrome, if you can tell. Basically it's a syndrome with hemorrhage. We have a triad in this syndrome. It's a hemorrhage, jaundice, and acute kidney injury. So okay, I think no one wants to tell. Okay, the muscle wasting. Muscle wasting for what? Muscle wasting for what? It's not a case of muscle wasting. It's basically it's a case of Weil's disease, and in case of Weil's disease, it's caused by leptospira. So yeah, it's a triad basically. It's a triad which I told. It's a hemorrhage, jaundice, and acute kidney injury, and there is a high risk factor for a paddy field worker. So yeah, it causes leptospira, that is Weil's disease, and the treatment of choice, as you know, for Weil's disease is IV ceftriaxone, or you can also give, that is penicillin also you can give, as it's a bacterial disease. So yeah. So next we move on. It's now you notice the child pulling to the standing position and then shuffling around by holding onto furniture. So at what age is this milestone typically attained? So yeah, it's a pediatric question. You have to know that is the milestones. So yeah, I'll just repeat. It's you notice a child who is pulling to the standing position and then shuffling around by holding onto furniture. He's basically holding on the furniture and standing. So at what age is this milestone achieved? It's 8 months, 10 months, 13 months, or 15 months. So yeah, if anyone can tell. Because he is holding and then standing. So what age is this milestone achieved? 8 months, 10 months, or 13 months, or 15 months. So yeah. Okay, the answer is, I will tell the answer is, that is basically in 10 to 11 months we see a child crushing. Crushing is basically he is pulling something and holding, that is standing. That is, it's an activity in which child pulls to the standing position and then shuffles. It's not 15, it's really 10 to 11 months. You are closely, but yeah, the answer is 10 to 11 months, and he then shuffles around holding onto a piece of furniture. So yeah, it's an activity called cruising, which occurs in the 10 to 11 months. Let's we move on. The local anesthetic with the maximum amount of unionized drug at physiological pH is. It's a common question, and the options are bupivacaine, chloroprocaine, pilocaine, or it's a lidocaine. I repeat, it's a local anesthetic with the maximum amount of unionized drug at physiological pH is bupivacaine, chloroprocaine, pilocaine, or it's a lidocaine. So yeah, if you can answer this. We generally use this in our casualty also. Okay, the answer is, if you don't want to tell, it's a D, that is the lidocaine, which has the maximum, that is maximum, he has the unionized drug at the physiological pH. So yeah. So lidocaine we use normally, that is it can penetrate the membrane, and hence PK correlates with the onset of action. So yeah. So it's a lidocaine is the right answer here. Let's move on. It's a 2-day-old neonate who has not yet passed meconium and developed abdominal distension. So barium enema was done and is shown below. So what is the most probable diagnosis? So yeah, it's basically, you can just think most common congenital disease causing that is a abdominal distension. It's very easy question. If you know this much only, you can just tell most common congenital disease causing abdominal distension. I'll just tell the barium meal, and yeah, the barium enema shows a dilated right colon with a transient zone in the mid descending action. So I repeat the question. It's a 2-day-old neonate, and he hasn't passed the meconium yet, and there is abdominal distension. So just tell me what is the common congenital disorder which we call it abdominal distension. And yeah, barium enema is also given here. Barium enema is basically showing it's a colon, that is the dilated right colon with transition zone in the mid descending colon. So yeah, I'll just repeat the options here: anal-atresia, Hirschsprung disease, meconium ileus, or it's a toxic mea colon. So yeah, at least now you can tell. Okay, if you don't want, there is no choice. I will tell it's a B, that is the Hirschsprung disease, that is mea colon only. So it's a Hirschsprung disease is the most common congenital, it's a congenital anomaly, or you can just tell congenital causing abdominal distension. So next we move on. 62-year-old patient with a history of diabetes and hypertension came with postmenopausal bleeding. So which of the following will you do to evaluate the cause? It's a pap smear, visible inspection with iodine, colposcopy, or endometrial sampling. It's also easy one. I'll just repeat. It's a 62-year-old patient with a history of diabetes and hypertension and came to you with a postmenopausal bleeding. So which of the following you will do to evaluate the cause? It's pap smear, visual inspection with iodine, colposcopy, or endometrial sampling. So yeah. Okay, see, they are just confusing here with diabetes and hypertension. See, whenever a patient comes to you with the postmenopausal bleeding, just think of carcinoma. You cannot think of anything else. Just think of carcinoma. So yeah, in case of carcinoma, what you will do? We will do a pap smear, visual inspection with iodine, colposcopy, or it's an endometrial sampling. So yeah, okay, the answer is it's basically D. That is the endometrial sampling we will do. See, pap smear is basically for screening, not for if bleeding is there, you cannot do. It's for screening beforehand only. If you want to do, it's pap smear. So yeah, they're only for biopsy only. So biopsy only you can do for this condition. It is a 62-year-old woman with postmenopausal bleeding. Next we move on. It's a 45-year-old patient who is a known case of rheumatoid arthritis. Presented to the clinic with the following deformity. What is it called? So yeah, I will only tell I think it's yeah. Okay, the image they have given in the image is only the answer, but I can just give you a hint. Okay, I'll give you a hint here. They have given an image to you, and it is caused due to excessive. Let's leave that. Just think there is an image, and it is basically it's excessive lateral deviation of the great toe with prominence of the head of the first metatarsal. Now just tell me what is the condition. It's hallux valgus, gout, or it's a hammer toe. So I repeat, it's a deformity which they have given in the image, and it is due to excessive lateral deviation of the great toe with the prominence of the head of the first metatarsal. So yeah, it's hallux valgus, gout, or hammer toe. So yeah, if you can tell. Okay, I'll just tell it's a case of hallux valgus. See, there is a difference between valgus and varus. In case of valgus, basically it will be like a lateral rotation, not lateral deviation. So if your body is like lateral deviation to something, suppose if your leg, or if in this case it's a toe, so if there is a lateral, it's varus. No, it's valgus. It's not varus. So if there is a lateral deviation, it's valgus, and if it is a medial deviation, it will be varus. So yeah, it's a lateral deviation. So it's a case of a hallux valgus. So let's move on. Which of the following is the most common cause of LMN, that is the lower motor neuron facial nerve palsy? Options are Bell's palsy, Ramsay-Hunt syndrome, cerebellopontine angle tumor, or it's a post-operative. It's a very easy question. I'll just repeat, which is the most common cause of LMN. Just think LMN, it is LMN facial nerve palsy. Options are Bell's palsy, Ramsay-Hunt syndrome, cerebellopontine angle tumor, or it's a post-operative. So yeah, so we have done this before. Not done before, but yeah, we know this, I think. Most common cause of LMN palsy. It's an idiopathic ipsilateral lower motor neuron palsy. So yeah, if you can tell. Okay, the answer here is it's basically A, that is it's a Bell's palsy in this case. And Bell's palsy is the most common cause of LMN facial nerve palsy. So yeah, it's a Bell's palsy. So next we move on. It's a patient is there who is suffering from hyperthyroidism and is administered a drug that acts by inhibiting the release of thyroid hormone. So identify the drug. It's propylthiouracil, radioactive iodine, thiocyanate, or it's a potassium iodide. So if you can tell, it's a patient who is suffering from hyperthyroidism and is administered the drug. They are asking for the mechanism of the drug. Mechanism they have given. They are asking to identify the drug. It basically acts by inhibiting the release of thyroid hormone. Options are propylthiouracil, radioactive iodine, thiocyanate, or it's a potassium iodine. So yeah, if you can tell, it inhibits the release of thyroid hormone. Anyone? Okay, the answer is basically the answer is D, that is potassium iodine. You know, it's potassium iodine is basically Lugol's iodine, and the mechanism for Lugol's iodine is that only, that is it inhibits the release of thyroid hormones from the, that is in case of a hyperthyroidism. So you can give that. So yeah, I will just tell that that's what they have given is other options they give: propylthiouracil, radioactive iodine, and it's a thiocyanate. So yeah, I will just tell what are they. See, propylthiouracil is like inhibiting the peripheral conversion. So yeah, when a drug is given for inhibiting the peripheral conversion, it's propylthiouracil, And other results are basically that glucose iodine, which I told, it's a potassium iodide, and it inhibits the hormone release. So yeah, moving on to the next question, we have it's which of the following condition it's not a med exception. So yeah, the option is hepatopulmonary syndrome, portopulmonary hypertension, or it's a primary hyperoxaluria, or it's a chronic hepatitis B. So yeah, if you know it's what is a med, then only you can tell this. Anyone? Which of the following condition is not a med? That is, med is basically, I'll just tell, it's a model for end stage liver disease. So yeah, the options are hepatopulmonary syndrome, portopulmonary hypertension, primary, that is the hyperoxaluria, or it's a chronic hepatitis B. So yeah, if you can answer this. I also don't know this. I am only studying for the first time. Yeah, if you can answer this. Okay, the answer is only it's chronic hepatitis B. That is med. That is, it is used to prioritize. Basically, it's a score which has been given to prioritize patients, that is, who are awaiting for liver transplantation. So yeah, it's, however, there are certain diseases that impair the patient's survival and are not accounted for a med score. So yeah, it's for a chronic hepatitis B, which is not an exception. So yeah, last question, we will move on. The last question for today is, how many molecules of acetyl coenzyme, that is, are produced in the beta oxidation of palmitic acid? And the options are 6, 7, 8 and 9. I repeat, how many molecules of acetyl CoA are produced in beta oxidation of palmitic acid? It's 6, 7, 8 or 9. So yeah, if you can tell, if you can remember it. So okay, you have to remember this, there is no choice for you. It's, the answer is, that is 8. So yeah, 8 molecules of acetyl coenzyme is produced in the beta oxidation of palmitic acid. So yeah, for today it is over. And yeah, thank you so much for joining, and take care. Good night.